Hey, hospice nurses, how many times have you heard one of your patients just say, I just feel lousy, and then you try to suss out, what is it? Are you painful? No, I don't think so. Does anything hurt? No. Are you nauseated? Feel queasy? Not really. Are you dizzy? And we go through the litany of symptom management questions, and they can't come up with anything specific. They just say, I just feel bad. I just feel lousy. And then of course, I often say, well, if we need to get a little more specific so we know how to help you, but oftentimes you just can't come up with anything specific. So what do? Sometimes I feel like a drug pusher, and I'm just going to say it, but it's true. Oftentimes we know that people abuse medications to get euphoria, to get a side of this, use the side effect of euphoria and a feeling of well-being when they use a narcotic. We know that happens on the street. So in an absolute pinch, I have to admit, sometimes I say to my patients, hey, can we please just try the narcotic? You've never tried it because you said you never hurt. In fact, a lot of times there's resistance to trying a pain medication when they say they don't really hurt. And yet sometimes a little touch of the narcotic that's come in your comfort kit, give them the smallest dose possible, stay with them, find out how they feel a half an hour later. A lot of times they start to recognize what feels better. Then once they know what feels better, then you can be more specific in your symptom management. And what's our goal in hospice care? It is to provide comfort and a quality of life that allows the person to feel the best they can for as long as they can. And we are pros at symptom management. Sometimes it eludes you, but there's always something to try. Please get our $17 book, because this is a crash course in every aspect of hospice care and symptom management. We want it at the bedside of every patient. It's used as a workbook, and it works for a patient when it's 2 o'clock in the morning and you're not there. Okay, this is Nancy with the Hospice Care Plan signing off. Have a great day.